Thank you for the introduction, and thanks for having me. I'm very happy to be here. And as you said, I'm a healthcare industry technology strategist. It's a fancy name for I'm responsible in Western Europe to drive innovation, and I drive innovation with our healthcare customers, and this can be anything. And in the last 3 months or 2 months and a half, I don't know if it's been so long or longer, we have been doing a lot with our customers to tackle the COVID waves. And today I want to focus on a particular part on what we did with the bots. How did we enable conversation intelligence to enable caregivers and patients mitigate with the COVID? So for this, based on what I saw and based on what we did, I split it up on a couple of waves. And one of the first wave that we saw when the pandemic hit in Europe, that there was a lot of chaos, a lot of questions. Hospitals were getting a massive amount of questions. Patients did not know if they had COVID, if they needed to go to the hospital, what do they need to do when somebody was sick. So there was a massive lack of providing objective information and enable pre-triage at scale. And for that, we deployed the HealthBot across Western Europe together with our team. In about 3 weeks, we got 25 implementations, where one implementation is, for example, the whole Danish country, where we went from one region, the region Hovedstaden, the capital region, to 5 regions in 2 weeks. And I'll explain later more on that case. Another wave we then saw, or another useful part we saw, and I just heard in the previous presentation, which is really interesting, was now that they had that massive amount of data. To give an idea, in Denmark, we had about 150,000 unique users in 2 weeks. So they had a massive amount of data, and there was, in some HealthBot scenarios, there were some data points we collected. For example, we asked on an optional base, can you provide us your gender, age, and location? And based on that information, plus the whole conversation flow of the self-assessment, the hospital could find out, or the hospitals or the governments or the pharmas could find out that, is there a hotspot somewhere in my region? If people are talking to my bot and all the people who are having the conversation are saying, I have a fever, or I think I have a headache, or I'm tired, they know, or they can potentially see that there's a hotspot. And if they start correlating that information with, for example, age or gender, some hospitals even started at some point to optimize their staffing in the hospital based on the bot information. Because if at some point a lot of questions or a lot of conversations go to the bot, and the hospital sees 80% are high risk, then they know at some point that in a couple of days there will be a flood of people coming to the hospital because they went to the bot and they think they have COVID, or maybe they have COVID, or maybe there's somewhere a hotspot. So that was very, very interesting to see how much they did with the data. And they started with the bot data, but at some point, with some of my customers, we're now creating digital twins of patients based on medical record data, based on telehealth data, plus the bot data. And the next wave we saw then, if I find, yes, was self-observation. So we provided an option to do triage and give information. We captured the data, but what if people who were potentially at high risk or were exposed, how can we follow up those patients in a good way? So when you were exposed, some people were exposed but were not very sick. So we needed to monitor those patients, but not in the hospital, because it's too risky to infect other people. So for that, together with a couple of customers in a couple of days, we created a self-observation scenario in the HealthBot that is linked to a fire server that allowed patients to provide their own parameters. And again, we didn't know who the patient was. So at the end of the triage or at the self-assessment scenario, we asked them, look, we see you're a high risk, but at this point, we don't think you need to come. If you're very sick, always go to the hospital, liability. But if you want, you can have this unique code. And if you come back to me, I can get your unique ID and provide all those observations in your personal fire, let's say, store. And the next time they come back, they can have the availability to see the previous history. And even when they are admitted in the hospital, they can provide a link or a PDF to the doctor to provide them the history. So the doctor has some info about the last week, about the last day. And we store this in FHIR, which is Fast Healthcare Interoperability Resource. It's a healthcare standard, which a lot of medical records are now building their standards. So it could easily be integrated into the medical records. And the next thing we saw is a lot of hospitals are now preparing for the next, not gonna say wave, but the next hiccup in the fall, because they think that in September, October, there will be a second spike. So now, based on the data they captured, based on the learnings they have, we are working together with a lot of interesting partners who are dedicated in creating AI models. And based on that, we want to create more intelligent risk assessment AIs. Because now most of the scenarios in the bots were the only, or the AI we used was NLP or NLU to get the intent and the entities and drive the conversation. But now we have the data to actually get a risk assessment AI bot who can, based on free text and open questions, get a more fluid conversation. So this is now happening, and there's already a couple of them live, and there will be more going live. And this week, we released a new scenario. It's a very relevant one, the back to work scenario, because we see that luckily, a lot of offices are opening, but there's a lot of regulation going on, a lot of checking, a lot of distancing. And here what we want to enable is COVID now is 6 months free for everybody who wants to use it. You need to get in contact with someone from Microsoft, but it's 6 months free. Teams is 6 months free. So we want to make sure we can provide this technology, but also use cases that they can use. So now at the back to work scenario, which I will explain later, we provide a scenario in guidelines with the CDC. And I saw the CDC on the slide before, or on the presentation before. So with the CDC, we created those templates where somebody who has Teams or a web chat gets every day a proactive message saying, hey, can I ask you some questions? And based on those questions, you get assessed to go to work or not. So these are high level, the 5 waves that we've seen and we were working on. And this has all been done with the HealthBot. So the HealthBot has templates like you see here. You can see those templates as Word templates, or as, I think Word templates is the best. You click on it, you get a template that you can modify. And I'll show you in a second how that works. And we added more, and the customers could easily modify them. And before I go into some use cases, a quick intro on what the HealthBot is. So the HealthBot went live 2 years and a half ago, and was originated out of Microsoft Research. So Microsoft Research is an independent organization in Microsoft who dedicates on research projects. And this bot project, this healthcare bot project, went live into our cloud 2.5 years ago. And it combines actually 2 things that are almost never found in the market. Is one, you have a symptom checker. So you have a bot that understands healthcare and is compliant, GDPR, HIPAA compliant, HITRUST compliant. And it can also be extended and customized. So it can easily integrate the backends, or it can be extended to any needs, which we've done here massively with the COVID. And very important, it can be personalized. So we're actually taking a SaaS platform. This is a software as a service. You can see it like an office, but this is a HealthBot, where you go to a website and out of the box, you have a bot that understands healthcare, is compliant, can be integrated and customized. So how does this look like? So when our doctors or our physicians, because that's where we mostly work with, we almost never engage with IT only to deploy the bot on the website, but mostly was done with the healthcare providers to validate the scenario. We go with them to the portal, where you see on the bottom in the center. And when we go to the portal, they can create those scenarios together with us based on a template. This can then easily be integrated into their own backends, or easily this is easily be integrated into other services. As long as it has HTTP, it can be integrated. And because it's based on the bot framework of Microsoft, we have the possibility to use the different channels. So we can use Teams as a channel, we can use Facebook, we can use Twilio, because we also had use cases where you work with elderly people that you don't want them to go to a mobile app, but you want to send them a text message, and they answer the text message and the bot knows what to do. So the bot is smart enough to parse those channels and give it to the right users. And to give an idea on how we did this and how those scenarios look like, this is, for example, a small screenshot about how you create those scenarios. So this is a simple overview or a simple scenario where this is a prompt, which also can, if we have people who understand or know the bot framework, you have adaptive cards, so you can make those beautiful cards. You can have switches. These are labels. So it's easy to, via drag and drop, get the whole scenario, test it in line, and you can see the variables and much more. I mean, I'm not going to talk more about the HealthBot because I think it has over 300 configurations. You can have translations, handoff to Teams, enable telehealth, interrupting scenarios, etc., etc. But this was the base on how we enable those scenarios. And to come back to my initial scenario or my initial customer in Denmark, because this was great because we started the Thursday evening where we had a conversation with the director who said, normally we have 2,000 calls a day. Now we have 6,000 calls a day, and this is increasing by 30%. And I cannot get so many people to answer the phone. So people were dying almost on the phone because they couldn't get help, and they couldn't get to the doctor because they needed to get referred first. So within 2 days, we went from initial conversation to production in Region Hovedstaden in Denmark. And this went on and on and on all Europe, where our record was 1 day conversation deployment in production. And to give an idea how this works, on the left side, you see some information about the bot. We made it really dummy proof. So when you click on a button, we disable it. We even, for some scenarios, disabled the input button. And on in the middle of the screen, you see the self-assessment of corona disease. This is the optional form that's being used. And on the right side, you see then Power BI. So we gave those customers Power BI, where they can use the data of the bot to, for example, as I said, see hotspots. So on the left side, you see the map plus the hotspots. The green and the red circles, that is the questions they answered and what most of the answer was. And then you can start correlating with age, gender. They added sentiment analysis. They look what KPIs of what persons resulted in which answers. So they got rich results based on the limited data they got. And for that, we also create some code snippets. So it was very easy for other partners and customers to implement. Looking at an architecture perspective, this is very easy. You have the HealthBot, you spin it up, it's SaaS, we log it to something we call Application Insights, and that's a service who just captures all logs, and then we visualize in Power BI. That's how easy it was. And then, as I said, the next step was a self-observation. So here we took the bot out, and it's particularly the same backend, but just another scenario. So a bot can have multiple scenarios. And here, when you start talking to your bot, on the right side, you see table. That are your previous observations that you provided. And you see the PDF button. If you click on that, you can export it to a PDF, or you can get a link to provide to your doctor. So that was a way to say, okay, let's extend the scenario, let's enable self-observation, and let's add risk assessment. And then we, as I said, we started with partners who have at this point already AI, but who can enable more scenarios. And because the HealthBot is extendable, it was very easy to integrate them. So we already integrated with partners such as Symptoma or Ansys, and I think they're all from the, Ansys I think is from Nordics, Symptoma is from Switzerland. So we got together with the real specialists, because we as Microsoft, we're a platform. We're not an, let's say, a healthcare specialist firm, but we know the industry, but we leave those, let's say, AI models to those partners. And if you look at the architecture, then what has been happening is that, okay, we have the health bot who goes to the application insights, and we store that in a data lake. And the same goes for AI partner solutions who also generate data, their risk assessments, their output of their models. But we also store the self-observation data of the health bot or the back-to-work data of the health bot in the fire server in an Azure API for Fire. So we have a managed fire server or an open source one. And we also partner up with companies who provide remote health, telehealth with devices. We could all store that centrally. And now, for example, in Finland, there are already hospitals working together with partners to create predictive analytics, to, based on certain parameters, and start creating predictive analytics. And to be very honest, what we did in the last 3 months was regarding digital innovation was more than we did in the last 5 years. So a lot of hospitals have seen the need and the benefit of technology based on what data can provide them and how remote care, telehealth, and bots could help them do their work better and focus on the patients. And then the last thing I want to say is with the back to work is, this is a bit how it looks like in Teams. So here what we do is every day there's a trigger going on, and every day the customer, say at 8 o'clock or 9 o'clock, the bot asks, okay, were you exposed? Do you have what we call primary symptoms? It could be fever, could be breathing issues, could be headache. And based on those questions, the bot assesses if you can go to work or not. And all that data is again stored in a compliant fire server. And the good thing is, or not good thing is, but the thing is, when the patient is at some point exposed or is positive tested or has too many symptoms, the patient is put in quarantine by the bot. And the next day comes back, the bot will say, okay, you've been quarantined 2 days ago, and you should stay 6 more days in quarantine. And if you don't agree with this, please contact this person. But the patient or the employee always knows what to do at some point. So this has now been live, I think last week. It is going to be used with a lot of big healthcare organizations, starting with the US first. I'm already working with some of the customers in Europe, but this will especially help our customers go back to the workplace and to provide that capability. So that is for me. I got my 15 minutes, so I went 2 minutes over, but thank you for listening.
Thank you, Bert. Very, very interesting. So just a reminder to the audience, if you have questions, you can post them in the chat window and then we will be able to pick them up. I do have one question from my side. I mean, you did mention, for healthcare providers, they have gone through, drastic transformation in the past couple of weeks. So in addition to implementing, chatbot, what else, when it comes to data and AI, you see them embracing during the COVID situation?
Yes. So one customer, we started with a health bot. We then went to a self-testing platform for their employees. And now we are starting to create a way to create a central data lake. So they want a data lake. We are creating a digital twin of, for example, their remote data, of their clinical trials, of their bot data. And based on that data, they want to create patient portals and start creating clinical apps, CE marked applications, based on the data they have to create what we call clinical support tools. So we see that more and more coming up. The data strategy is something that hospital sees now as a very important part in how can we leverage the data in a better way and how can we enable interoperability. And that's becoming a big thing in Europe.
Yeah, I think that's a very, very good comment. I mean, obviously, the chatbot is only the interface, and what is fueling the whole intelligence behind is the data. I think more and more organizations are realizing the value of the data and, applying different technology on top to realize the value. I also heard similar comments, from my colleagues in Switzerland, talking about, in the public sector, in the government agency, they also have gone through, 3-year digital transformation in 3 weeks. So that's similar to what's happening in healthcare during COVID. All right,
Yes.
I see no questions in the IM window. Thank you, Bert, again. Thanks for sharing, and please stay with us, and there might be questions popping up, so you can address directly in the IM window.